we shall be talking about the anatomy of the nose. The nose has external nose and the nasal septum and the nasal cavity. External nose. External nose is pyramidal in structure, also known as nasal skeleton. It is made up of osteocartilaginous framework covered by muscle and the skin. The external nose has the bony part and the cartilaginous part. In its upper one-third, it is bony, and its lower two-thirds, it is cartilaginous. The bony part has the pair of nasal bones. This is the pair of nasal bones, and the ascending process of the maxilla. This is maxilla. So ascending process of the maxilla, and this is frontal bone. So nasal spine of the frontal bone. This is the bony part. Pair of nasal bones, ascending process of maxilla, and the nasal spine of the frontal bone. In the cartilaginous part, we have upper lateral cartilage, lower lateral cartilage, septal cartilage, and the sesamoid cartilage. This is the root. This is the dorsum tip. This is the columella. This is the ala, and this is the nostril. Here we can see this is the columella. This is the nasal tip. This is the dorsum of the nose. This is the root of the nose. This is the nasofacial groove. This is the ala and the alar groove. Nasal septum and the nasal cavity. The nasal septum divides the nasal cavity into right and left halves. The nasal septum have the bony part and the cartilaginous part. In the bony part, it has 3 major bone and the 4 minor bone. We can remember as 3 plus 4, 3 major, and the major bones are vomer, perpendicular plate of ethmoid, and the rostrum of sphenoid. Sphenoid, ethmoid, and the vomer. And the 4 minor parts are the nasal spine of frontal bone, nasal crest of nasal bone, nasal crest of maxilla, and the nasal crest of the palatine bone. And the cartilaginous part are the quadrilateral cartilage, medial cross of upper lateral cartilage, and the lower lateral cartilage. Nasal septum is rarely straight. Deviated nasal septum is common. In this, the patient is asymptomatic. If there is marked deviation, which cause nasal obstruction or external deformity called the crooked nose. Here we can see the bony part has vomer. So here we can see this is the vomer, perpendicular plate of ethmoid. This is the perpendicular plate of ethmoid. This is the rostrum of sphenoid. This is the rostrum of sphenoid. This is the rostrum of sphenoid. Perpendicular plate of ethmoid, vomer. This is the 3 major bones of the nasal septum. Then the nasal spine of frontal bone, nasal crest of nasal bone, nasal crest of maxilla, and the nasal crest of palatine bone. The nasal cavity. The nasal cavity extends from the external nares to the choana, where it becomes continuous with the nasopharynx. Nasal cavity has roof, floor, medial wall, and the lateral wall. Its floor is made by the hard palate, maxilla, and the palatine bone. Its medial wall. This is the medial wall. Medial wall is formed by the nasal septum. This lateral wall has 3 turbinates and 3 metatarses. And the roof. In the roof, the upsloping anterior part has the nasal bone. Horizontal medial part has the cribriform plate, skull base. Downsloping posterior part has the body of sphenoid. Turbinates is the bony projection on the lateral wall of each nasal cavity. There is 3 turbinate: inferior turbinate, medial turbinate, and the superior turbinate. The inferior turbinate is the largest and most bulky. It is visible in anterior rhinoscopy. Medial turbinate and the superior turbinate, which is the smallest turbinate, it is not visible on anterior rhinoscopy. To visualize the superior turbinates, we need endoscope. The bony turbinates are covered by nasal mucosa with vascular channels and venous sinusoids, which help in warming and humidifying the air and alter the nasal resistance. Metatarses are the groove-like passages which is inferior or below to the bony turbinate. Below the bony turbinate, there is metatarses. Inferior meatus. There is 3 meatus, as there are 3 turbinates, inferior, middle, and the superior. There are 3 meatus. Below turbinates, inferior meatus, middle meatus, and the superior meatus. Inferior meatus is inferior to the inferior meatus. Nasolacrimal duct drains in the anterior part of the inferior meatus, and this duct opening is guarded by the Hasner's valve. Middle meatus is inferior to the middle turbinate. Middle meatus is the most important because many structures lie here. Anterior group of sinuses like the frontal sinus, maxillary sinus, and the anterior ethmoidal sinus drains in the middle meatus. All these sinuses drain through their respective ostia into a common drainage pathway known as osteomeatal complex. Osteomeatal complex comprises of the uncinate process, infundibulum, anterior ethmoidal cells, middle turbinate. Any obstruction in osteomeatal complex interfere with drainage of the anterior group of the sinuses. The osteomeatal complex can get obstructed due to anatomical obstruction or if there is any inflammatory obstruction. Anatomical obstruction can occur because of large concha bullosa. Concha bullosa is the air-filled cavity within the turbinate. If there is deviated nasal septum, then it can cause obstruction to the osteomeatal complex, which is the anatomical obstruction. If there is large halar cell, here in CT scan below the orbit we can see the halar cell, then it can get obstructed. Large halar cell. Halar cell is the infraorbital ethmoidal air cells. And the inflammatory obstruction, if there is mucosal edema due to infection, allergy, and the polyp. This anatomical obstruction and the inflammatory obstruction lead to predisposed to the rhinosinusitis. Here we can see this. This is the turbinate, which is the Brony projection, superior turbinate, middle turbinate, and the inferior turbinate. And below the turbinate, below and lateral to the turbinate is the superior nasal meatus, middle meatus, and the inferior meatus. This is the osteomeatal complex. This is the osteomeatal complex. This is the middle turbinate. This is the middle meatus below the middle turbinate. This is the inferior turbinate. This is the uncinate process. This is the maxillary sinus. This is the ostium of maxillary sinus. This is the ethmoidal bulla. This is the nasal septum. This is the ethmoidal air cells. So, the osteomeatal complex comprises of the uncinate process, anterior ethmoidal cells, middle turbinate, and the infundibulum. The uncinate process. This uncinate process this is the part of the ethmoid bone. This is sickle shaped, as we can see. This is the sickle shaped. This posterior superior border is sharp. This lies anterior to the hiatus semilunaris and the bulla ethmoidalis. Hiatus semilunaris is the space between the uncinate process and the bulla ethmoidalis. Bulla ethmoidalis is the largest ethmoidal air cells. Infundibulum, which is the funnel-shaped 3D space in the anterior ethmoidal region. Medially, it has uncinate process. Laterally, it has lamina papariaceae. Anterosuperiorly, there is frontal pubis of the maxilla and lacrimal bone. Posteriorly, by the anterior part of the ethmoidal bone, opens into the middle meatus. Infundibulum also opens into the middle meatus through the hiatus semilunaris. Now, the superior meatus. We studied about the inferior meatus, middle meatus. Now, the superior meatus. The superior meatus lies inferior to the superior turbinate. Posterior ethmoids drain into it. Nasal vestibule. Nasal vestibule is the dilated anterior-most part of the nasal cavity lined by the skin. Hairs are present in the vestibule, due to which furuncles commonly occurs here. Nasal valve. Narrowest part of the nasal cavity is the nasal valve. There are two valves, internal nasal valve and the external nasal valve. The internal nasal valve is defined by the angle that the septum makes with the upper lateral cartilage, usually 10 to 15 degree in Caucasian. This decrease in angle indicates there is obstruction, as it is the narrowest part of the nasal cavity. Functions of the nose. Nose helps in breathing, air conditioning of the inspired air, protection of lower airway, ventilation and drainage of paranasal sinuses, olfaction, nasal resistance, vocal resonance, and the nasal refluxes. This is all about the anatomy of the nose. You can find these notes on the Telegram and the links are given in the description. Thank you.